I shall now demonstrate the fundoscopic examination. Assuming this were the patient in the exam, you could give the following instructions. I've been asked to examine the back of your eyes, and I need to get fairly close to your face to do that. You can breathe normally, and you can blink if you'd like. Okay. I'd like you to pick a fixed point on the wall over there and keep looking at it. And then you could examine the right eye of the patient, approaching him from his right, using your right hand and your right eye in this manner. As soon as you maintain a particular visual axis, you should be able to see the red reflex, which you may want to comment, indicating the media is clear. Then, maintaining the same visual axis, proceed in this manner till the retina or the fundus comes into sharp focus. You may want to study the appearance of the optic disc and then go on to examine the four quadrants by slightly tilting the ophthalmoscope to examine the upper nasal, lower temporal and upper temporal quadrants. After having done that, you can ask the patient to look directly into the light. Can you look into the light, please? And this brings the macula into sharp focus. Thank you. You may then want to repeat the same process for the other eye. Often in the exam, the examiner will ask you to stop at this stage and have a look at the mannequin, which will have abnormal findings or maybe normal findings even. This would be an example of how a mannequin would look like in the real exam. And essentially, the mannequin has slides with abnormal findings or normal looking retina inserted, which is illuminated by a source of light. And if you were to use the ophthalmoscope to examine the mannequin, the light source coming from the ophthalmoscope may often clash with this background light and will cause diffraction. And it may be sensible to switch it off and approach the mannequin using the ophthalmoscope with this light switched off. For example, you could do this. Also, I've been told by some candidates that examiners often advise the candidates to approach the mannequin with your own bare eyes in this manner. You would want to again study the optic disc, the four quadrants and the macula and comment on them.